Keir Starmer.
It was all smiles and confidence today after Labour stepped up its game at the local elections. Sir Keir Starmer unveiling new plans for the NHS alongside some more familiar warnings about its future.
I don't think the NHS survives 5 more years of Tory government. And people say, oh, well, we've heard this before. The Labour Party is always saying it's time to save the NHS. But I say, look squarely in the eyes of the people who work in the NHS, who serve the NHS, and ask them.
Centre stage, ambitious new targets and a new focus on prevention, early diagnosis and technology. What was missing, though, how much it will all cost.
How do you expect the public to trust you with the public finances if you're not prepared to say quite straightforwardly, these are our plans, this is how much they will cost, and this is how we will pay for them?
This challenge you put to me that we've not said where the money's coming from is just wrong. Actually, are we going to have the biggest increase in training for the NHS that it's ever had in its history? Yes. Are we going to pay for that by abolishing the non-dom tax status? Yes. So what we've been careful to do is to say where we're making changes, what the change will be and how we will pay for it.
Labour's list of all the things that they would do to improve the NHS is a very long one. There is no shortage of ideas. But what about patients? Do they believe that the party can deliver on all of these promises?
Keir Starmer's track record of making pledges and then reneging on them is something he needs to address, I think.
I don't think it's in good hands under anybody, because I honestly don't think they know what's going on at the sharp end.
Some people saying you need more money, but the point is, do we have enough people who actually want to work in the health system? You know, that's the thing.
Some reservations as well from a leading health think tank.
The commitments around heart disease and cancer are reflecting a realistic 10-year plan to improve. But Keir's also committed to restoring NHS waiting time standards within 5 years. Those standards haven't been met since 2015. This isn't just a backlog caused by the pandemic. This is a long-term challenge around the performance of the NHS. And I do think 5 years, whilst it's right to be ambitious, it's probably not deliverable.
Thank you.
Today was Labour trying to convince voters it is ready for government, part of a journey they hope will end at Downing Street. Liz Bates, Sky News, Essex.